Hello, I'm Kaitlan Ahrens. I'm one of the trauma surgeons at Lawrence General. Today I will be talking a little bit about chest tube insertion, specifically focusing on securing the chest tube. So after I make sure that I am in the chest by doing a finger sweep, I place my tube. I want to make sure it's at an appropriate depth and make sure while I'm securing the tube that it is not slipping out and remains at an appropriate depth within the chest. One of the other key steps that is sometimes used is to spin the tube to make sure it's free within the pleural cavity. So after my tube is within the chest, I will throw a simple interrupted suture through the skin. Today my mannequin has some gauze so that I do not hurt the mannequin. I cut off the needle so that I don't have any sharp injuries. I throw a knot to close down the skin. Sometimes I have to place another couple simple interrupted sutures in the skin if my incision is large. I can use 0 or 1 silk suture typically, and typically silk. This is proline, but silk is useful. After I have thrown my simple interrupted suture, I throw both ends of the suture around the tube, and then I do another throw on top of this chest tube, and then I cross it again and tie the knot down. This is in contrast to doing the widely popular sandal maneuver, where the suture is thrown around the tube many times. The danger in doing this is that if the knot is not tight, there's a lot of redundancy in the suture and it's loose and the chest tube can fall out. This way, like I said, crossing the suture once around the tube, doing a throw, and then crossing again around the tube and tying the knot is a very good way to ensure that the chest tube is in good position and secure. If I'm concerned that this isn't tight, I would do another knot and securing suture below the tube. Thank you.